So we're with our trimester 2 patient here. This is Emily, my sister-in-law, and she's super special because she's pregnant with my little niece, right? Emily, you're 24 weeks pregnant, so well into trimester 2. Is there anything in particular you're feeling today? Any pain or discomfort of any sorts?
A little pressure in like the tailbone area.
Tailbone area, which is something we've been working on with Emily. Another common thing is like round ligament pain. Any pain kind of into the groin area?
That is starting.
Sure, we'll work on that today too.
Yeah.
So I'm going to have you move face down and lay on your stomach, okay? All right, so as we enter trimester 2, this is usually when the back pain starts to present itself. So you can imagine as that belly starts to grow forward, that your center of gravity also shifts forward as well. So all these joints in the back of the spine start to tend to compress, and they start to develop those symptoms like Emily presented with, like a pressure in the back of the spine near the tailbone or that sacroiliac joint. So we're going to work through that with Emily today. And just a quick note, a lot of the treatments that you're going to see on Emily look very similar throughout pregnancy. It's just a matter of the patient's comfort. So Emily, I want to make sure you're comfortable down there on your stomach.
Okay.
So remember the baby bump's there, so a lot of people might be like, why is she laying on her stomach with a... There's actually a breakaway piece here, thoracic piece, that allows room for that pregnant belly to kind of sit comfortably. And a lot of patients will say it's the only time they'll get to lay on their stomach throughout entire pregnancy. And they usually love it. So we're just going to check the alignment of Emily's pelvis here. Good. So I'm seeing a little shortening on the left side of her pelvis. Good, that looks beautiful. We'll just check the sacrum here. Overall, that looks pretty good. There's a little bit of fogginess on the left side there, so we're going to adjust the left side of her pelvis and the right side of her sacrum. Okay. Nice and relaxed. Beautiful. No discomfort. Good. One more. Beautiful. So a lot of people wonder about, like, what is the frequency that you should see a chiropractor? Sorry guys, when you're pregnant, we usually recommend that you line your chiropractic visits up with your OB visit. So if you're seeing your OB once a month, then you need to be seeing your chiropractor once a month. As your OB increases frequency, like Emily's entering into trimester 2, so they'll probably soon be pushing her to like a bi-weekly OB appointment. So we'll recommend that she sees us bi-weekly. And then towards the end of the 3rd trimester, we'll recommend that the patient presents weekly, just like they do to their OB, right? And that just helps get them ready, make sure there's no underlying fixations in the pelvis, and helps ease up that birthing process. All right, so we've got Emily on her side here, ready to adjust that left sacroiliac joint that was really rotated on her. Is this position uncomfortable?
No.
So we always tell all of our patients, pregnant or not, if any position I put you in, or if anything in particular that I do is uncomfortable for you, you let us know and we'll change it right away, okay? So we're just going to get her into what we call lockout, so we can isolate that sacroiliac joint and just apply a nice gentle adjustment. Beautiful. How are we doing there?
Good.
Good. That's the top shoulder. Good. Excellent. That was beautiful. All right, so you're going to lay right on your back for me. So Emily had mentioned in our intro that she's starting to see some discomfort in kind of her groin area. This could be a round ligament origin. The round ligament is a ligament that attaches the uterus to the front side of the pelvis. So we're just going to check the tension of that ligament right here. It's a very, very gentle technique. So Emily, I'm just going to find your belly button here, okay, and your hip bone. And somewhere in between that, we're going to find that round ligament, okay? Is there a particular side that you feel more discomfort on, left or right?
Not yet. It's kind of just both.
Which side is the baby on, do you know?
Ooh, I don't know.
Yeah, they haven't said that to you yet.
More over here, I'm pretty sure.
More on the right side, yeah. Any tenderness here when I do this?
No.
No, good. So if there's a lot of round ligament tension, this contact will be very tender. It's almost like a muscular release, so it's very, very gentle. And if you could grab this kind of shot here, you could kind of see how gentle my hand is. It's just a very light pressure that I'm applying to the area, but it will absolutely alleviate some of that tension on that round ligament. Provide some relief of that groin pain. So we're going to swing around to the other side now. Check this side. So same thing, we're going to find the hip bone and the belly button. Good. How are we doing there? It seems like a little bit more tender on this side, or you don't feel much?
No, nothing
No?
uncomfortable.
Good. Do you feel any tenderness at the point where I'm touching, or not really? Good. So some patients, like I said, patients who are really tight, her round ligament's not sticking out, jumping out at me. So in this case, I would imagine that, you know, not too much discomfort's going to be felt from this. Emily's also not too large yet. She's getting a little baby bump.
Mm-hmm.
She looks great for 24 weeks. Great. Last thing we're going to do is we're going to just mold that pelvis, make sure we strengthen that pelvic floor. So bring your feet up flat on the table for me. Good. You're going to go feet a little bit wider apart, hip length apart. And you're just going to squeeze your knees into my hand here for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Beautiful. All right.